Hello, Assalamualaikum, and very good day to everyone. Welcome back to our subject EMGT 2143 or EAMG 3113, Health, Safety, and Nutrition in Early Childhood Education. For this week, we will be looking at Unit 2, which is Daily Health Observation. This is a very important area of health, safety, and nutrition management in early childhood education as well because daily health of observation is a very it's a very important skill, we can say, because we want to ensure that all of the children that come to the center, it's being screened accordingly to ensure that everyone's healthy are being taken care of. Before we go further, let's look at the learning outcome for this unit. So, by the end of this unit, all of you are expected to be able to first explain the importance of promoting children's health. Secondly, to understand observation as a screening tool, and then how to conduct a daily health check, and then maintain accurate health record, and then finally for you to be able to understand the screening process and referral procedure. Okay, so let's start by looking at the first subtopic, which is promoting a children's health. Okay, firstly, one of the most effective way teacher can prevent all of these illnesses is by fostering a clean and safe environment for all of the children. Okay, so this will include teaching and reinforcing about hygiene practices such as proper hand washing, cleaning, wearing clean clothes, or covering when they cough and sneeze. Okay, not only that, it can be to the extent to keeping personal item separately. So these simple habits, okay, are the key in preventing the spread of infection. Okay. So secondly, nutrition and physical activity are very important because teachers are the person who are responsible in supervising healthy eating habits and encouraging a regular physical activity. So this not only support children immediate health but also sets the foundation for lifelong wellness. Okay, by actively promoting these practices, our early childhood teacher can actually help to protect the children from all of these illnesses and become the very basic for their healthy future. Now, moving on to the second subtopic, which is observation as screening tools. Let's look at this very critical role of observation as a screening tools in early childhood education setting. So, daily observation is more than just a routine. It's our first line of defense in spotting early sign of illness. Okay? Simple indicators such as unusual tiredness, skin redness, or noticeable drop in appetite, all of these can hint an early stage of illnesses. Okay, but it goes beyond just physical sign. By paying close attention, we can also identify any changes in behavior, whether it's a child suddenly become very quiet or showing irritability or becoming unusually clingy. This behavior can signal discomfort or onset sickness. Okay, so observation isn't just about identifying symptom, it is actually help us to make decision. It helps us to determine if a child is ready for class, or if they need rest, or if they require a referral for further evaluation. So this is considered a proactive approach which not only support the child's health but also strengthen our communication with parents. So when we share accurate professional observation, we can also help parents to understand our concern and collaborate effectively for the child well-being. Moving on to daily health check. So there are some physical signs that all of the teacher need to observe during daily health check. So first, notice if a child has a warm forehead or whether they are sweating. So this could be a sign of fever. Remember that temperature is an essential indicator of how they are feeling. Okay, next, examine the skin for any sign of rashes, redness, itchiness, or insect bites. Okay, so, because this skin condition can often be early indicator of something more serious. Also, pay attention to any discharge from the eyes or nose, okay, because this might suggest an infection. Finally, listen to any sound of wheezing, coughing, or any difficulty in breathing, which are crucial signs that should never be ignored. Okay, by observing this physical sign, you will be better equipped to ensure the child's well-being and take appropriate action when necessary. Okay, so let's talk about behavior sign to watch during our daily health check. So first, look if a child seems unusually quiet or clingy, okay, or maybe refuse to play. So this might be a sign that they are not feeling well. These subtle changes can be just as important as physical symptom. Okay, next, listen for any complaint from the child like head pain or tummy pain or I'm tired. This can be early indicator as well of something more serious. So it is very important for us to pay attention and record them. Remember, the daily health check should be gentle but quick. Okay, usually this daily health check or health screening, it happens during drop off in the morning. So make sure to record anything unusual, everything before the child enter the school. Okay, it is best as well for a class teacher to do second check before they enter the classroom. Okay, so by doing so, we can ensure the safety and well-being of everyone in the school, including the teachers. Moving on to health record. So, a health record is also a very important record to have in our center because it's among the compulsory list that is required by the authority. Okay, so it is also considered as legal and professional documentation. Okay, so health record will provide a reliable account of a child health history, which is essential for both compliance and also our care. Okay, secondly, this health record can help us to track pattern over time. like recurring fever or other symptom. Okay, so this tracking can be very important in identifying any underlying health issue as early as possible. Another key benefit is the role of health record play in communication. They can actually support for effective communication with the parents and healthcare professional, ensuring that everyone is informed and also aligned on the same matter. Okay, remember to record the dates, the time of observation, also very important. Okay, what symptom you have noticed and what are the action you have taken. So all of these need to be recorded. Okay, and after that contact the parents. Okay, don't forget to log on to any notification to parents. Okay, and follow up results, right? Remember, confidentially is also crucial. Make sure record are stored securely and only accessible to authorized personnel. Okay, this is because we want to protect the child's privacy and also maintain trust with the family. All right, moving on to the screening process and a referral. Okay, so screening okay play a very important role as well in our childcare center. Okay, it allow us to detect any developmental or health issue as early as possible because this is very important for each child well-being. Okay, so by catching this issue as early as possible, we can ensure timely intervention, supporting for healthier outcome for all of the children in our care. Okay, monitoring the growth and comparing it against all of the health standard not only can help us to track progress but also ensure that every child is developing as expected according to their milestone. These are also considered as proactive approach, okay, which can help us to prevent any potential health concern from becoming more serious lah. Okay. Lastly, the screening can also help us to prevent any outbreaks. Okay, by identifying any potential health issues before it spread widely. Okay, this is important because it helps us to maintain a safe environment for everyone. Okay, now let's touch a little bit on the types of screening that we can conduct in our center. Okay, so it can include the screening of a vision and hearing check, as well as height and weight monitoring. Probably we can also do dental check by inviting the dentist, okay, and general physical health screening like the one we did every morning at school. So each of these play an important parts in our comprehensive health monitoring strategies in our center. So as a teacher, it is our important responsibility. Okay, remember, we do not diagnose. Okay, we don't give the diagnosis. It is beyond our beyond our abilities lah. Okay, we are not qualified for that. Instead, we only observe, document, and communicate any concern that we have noticed. Okay, so this ensures that all children will receive the expert care they need when they need it. Okay. So by working together with other teachers, parents, okay, and stay vigilant, we can actually create a nurturing and safe environment for our children. Okay, and then moving on to referral procedure. Okay, so when referral is necessary, when do we need to do all the referring processes? Okay. First, if a child show a persistent symptom, means that the symptom is longer than usual, like if they have a fever lasting than more than 2 or 3 days. Okay, so it is a clear sign to consider a referral to a hospital or to a specialist lah. Okay. Secondly, if you suspected a contagious diseases, it is very important to take an action promptly because we want to protect all of the children and the staff. Okay. Not only the children can get infected, but the staff as well. Third, if you're concerned about the child vision or hearing or any development that should never be overlooked. Okay, because early intervention can make a very significant difference to the child development. Finally, any injury that goes beyond minor first aid. Okay, for example, a severe cut, broken legs. Okay, so it should be referred to the healthcare professional lah, to hospital or to the doctors. Safety is our top priority. Okay, so to who to refer to? Okay, we want to refer, but to who? To our refer to. Okay, so first, always consider starting with the parents first because they are the first level of contact, emergency contact, and often the most invested in in the child's well-being. So, open, straightforward communication with them is very very important. Next, okay, you might need to involve clinic or hospital because they have the resources and expertise to provide for further evaluation and also treatment. Okay, depending on the situation, probably consulting a pediatrician or specialist might also be necessary because they are the experts, so they can offer more specialized care and also advice. So for school that have one, so maybe the school health nurse or um, health advisor. Okay, it's a very very valuable resources lah because they can provide immediate guidance and support to the about healthcare matters. So when communicating with parents, it is very important for us to explain our observation clearly and factually. Okay, tell them it is what it is. Don't try to cover up things. Okay, this approach help to prevent unnecessary anxiety and help us to build trust in the future. Remember, our goal is to ensure each child receive the appropriate care and support, making the referral process a collaborative effort. Okay. So that should conclude our topic for this unit. Okay. Until we meet again on our next unit. Thank you for listening, everyone. Assalamualaikum. Have a good day. Bye.